Today, officials from the Ministry of Health, KCCA, police and civil society fraternity have converged at the Uganda National Health Consumers Organization offices in Bukoto to remind themselves on the issue of tobacco control enforcement following the reopening of leisure places.
Calling upon them on the issue of enforcement of the Tobacco Control Act. We have received a number of complaints from different places reporting that shisha is widespread. Almost every bar in this Kampala, Wakiso, actually is selling shisha.
Mebo Kukunda, head of advocacy under the Uganda National Health Consumers Organization, reveals some of the resolutions of stakeholders, including intensifying the enforcement of Tobacco Control Act by holding more operations, especially on shisha smokers.
We have agreed that going forward, there is need to work together with different stakeholders to actually intensify the enforcement. And the KCCA and Ministry of Health have committed that operations against shisha use is actually going to start within this month, before the month ends. Also, we have seen that the destruction of those shisha pots that have not been happening is actually going to happen now.
Kukunda adds that they have resolved to request State House Anti-Corruption Unit to help while intensifying enforcement of the Act to avoid encountering issues of people, especially owners of some leisure places, who say they are untouchable.
The other resolution that we have made is that we are going to engage the State House Anti-Corruption Unit and to help us actually support enforcement of this act, because one of the challenges the enforcers, government agencies have given is that there are some people who are actually untouchable, and these people they know some people, they know big people, so their bars actually work like places like levels. Whether you do an enforcement today, tomorrow you find that they have their shisha pots, they are actually still working.
They have also urged the Uganda Revenue Authority to come on board and stop illegal entry of tobacco products. However, Dr. Hasfa Lukwata, Tobacco Control National Focal Person under the Ministry of Health, reveals the need for the establishment of the authority in Uganda to handle broadly the issues of tobacco control.
Ways that we can be able to have funds, continuous funds for tobacco control, would be if we got an authority. I know many people would not want to listen to the word authority, but we can even give it another name. But it's an institution, a body that will tackle substance use generally. Like they're having different departments, maybe tobacco, alcohol, maybe marijuana, cat, whatever. Like it can hire and fire. It has a budget to it. It's like there's money around it there.
Dr. Hasfa further reveals the future plans of the Ministry of Health as far as tobacco control is concerned in the country.
We're going to undertake development of the packaging and labeling standard for Uganda. We have the regulations, but after regulations, the UNBS is supposed to actually write out the standard properly.
This story was filed by Julius Muhumza for Dream TV News.